Welcome everyone to the first episode of HIV Real Talk, Real Solutions. Today we have a very special guest and the person who will be moderating the remaining 11 episodes, and she will be telling you more about that. Our special guest is Teresa Giles, and she is the CEO of Hope and Help here in Orlando, Florida, 4122 Metric Drive. On our first episode today, we are going to be talking about HIV. We're going to be talking about the solutions. But before we do, I think it is instructive that we go back to talking about where did Hope and Help started? Why did they start? So my first question to Teresa is, take us back to 1988 when I understand you guys first started. What was happening in Central Florida during the AIDS epidemic?
1988 was a year of fear and grief. If you can just remember, people were dying. They were dying alone. The AIDS crisis had been building for years. We were at a point where entire friend groups were dying. And the cruelty was that they were dying alone. They were dying in isolations. Family was disowning them. Hospitals would refuse to even take their bodies. Funeral homes would not take their bodies. People were literally dying in isolation because society had decided they were dispensable or they were disposable. So in Central Florida, there was a dedicated group of friends that came together. And at this time, there were no AIDS organizations in Orlando. There were no support groups. There were no one advocating for you. So a group of people came together. They decided, we're not going to do this anymore. Our friends are not going to die alone. They're not going to die without a community or without basic human compassion.
Tell us, how did Hope and Help begin in the midst of that crisis?
It started like most revolutions start, with a small group of people who literally refused to accept what they were seeing. A handful of friends in Central Florida watched someone they love die of AIDS. And they said, never again. No one should die without care. No one should die believing they're unworthy of love. So they started meeting in living rooms or in apartments. They drove people to medical appointments. They sat with families. And the thing about this, these were not medical professionals. These were not nurses or doctors. These were just people in the community that cared about each other. They wasn't asking for permission. They wasn't waiting for a law to come or someone say it's okay to do that. They stood in action. It was like any other revolution. They just started doing what needed to be done. That grassroots urgency, we'll figure it out as we go. That's what's in Hope and Help's DNA.
That is a fantastic story. So let me ask, did that small group of friends become the comprehensive health organization that Hope and Help is today?
That's a great question. It happened because the need kept expanding. It wasn't just their friends. And when word got around, they were called in every direction. At first, it was just practical support, like for food, companionship, making sure you don't have to die alone and die with dignity. But then they realized people needed help advocating for themselves. They needed to understand the medications. How do you do it? Is it a regimen? How do you take this and what's the impact? So they started advocating for doctor's appointment, making sure the patients understood the treatment. They realized people were having insurance issues. They were losing their houses. You know why? Because they were too sick to go to work, and then they would lose their job. So it just kept growing and expanding. Every time they identified a barrier to someone living with HIV, they came up with a solution. And that's how a formalized Hope and Help started in 1980. Today, we are a full-service medical clinic. What we want you to do is come here for all of your services, not just for HIV, your primary care. We're expanding into dental services. We're going to be expanding into vision services. We also have our pharmacy. So we want to be that one-stop shop. We can be that support. That's what we're striving for today, to be that full medical organization.
You often use the word dignity. Why is dignity so central to this particular story of Hope and Help?
I like this question because during this crisis, dignity was one of the most things that were stripped away from people. They were told that by some religious people that this is a punishment. They were told this is your fault. Some people just ignored them. They blocked funding. People wouldn't insure them. The media portrayed people with AIDS as a social outcast. Now, can you believe if you're going through some of the most difficult time in your life with your health, that everyone is turning their back on you? So when we talk about hope and helps, we're talking about people who insisted on a different narrative. They were not going to take this. They say you are not disposable, you are important, and you are not alone, regardless of your HIV status, regardless of your STI status, your sexual orientation, your color, your height, your size. You are not disposable. And it's still a revolution today. We still have that stigma because we live in a society that rank humans worth.
Amazing. And thank you for sharing that with us. So another question that I have for you is to share with us who were some of these members and what personally drove them to do this work.
Many of our founding members were part of the LGBTQ community themselves. They were watching their friends and partners die. Some were healthcare workers, frustrated by the system failures, frustrated by the red tape that they had to go through. And then there were just people that were in the community that wanted to support. What united them was a shared refusal to accept preventable suffering. You do not have to suffer, and you don't have to be alone. They were ordinary people who found themselves in an extraordinary crisis, and they decided to act. You don't have to be a doctor. You don't have to be in the medical field, but you could have that compassion, and you can be that advocate for someone in our community. You must show up for them. The founding members, they wasn't waiting for permission or for someone to tell them that. They saw a need, and they met it. That's why Hope and Help is still here today. We still see that need. We need your help. It takes a village. It takes all of us. Speak up. Say something. Come see us. 4122 Metric Drive. You're not alone. We're here to walk with you.
So, Teresa, talk to us about the services that are offered today to Hope and Help that was not available when you guys started in 1998. Elaborate for our listeners on the services that are offered by Hope and Help.
So we have a full service medical clinic, and that was something we saw, our founders, I believe, saw that they can treat your entire family. It is not just the HIV. Come to us with anything. Make this your medical home. And in this medical clinic, we have our doctors, our nurse practitioners, our medical assistants, everyone to make sure we can answer your questions, make sure we can walk with you and treat you. There's an episode that's coming up, I believe it might already be out, it's episode 4, when we talk about linkage, making sure that there's someone tied to you. Make sure you're not in this alone. What I love about that medical clinic is that each individual person, you don't have to be ashamed. We're there for you, and we're there with you. Another important part of what we have today is our pharmacy services. And what I like about our pharmacy services are our 340B program, which makes medications for those that qualify discount. Our pharmacy is also retail. We're there to sit with you to make sure the medications that you're taking and how you're taking it is better for your health. We also really have a full program on PrEP and PEP. Now, I want to say that slowly. PrEP, which is your pre, and PEP, which is after. We do have a whole episode on PrEP and PEP, so stay tuned for that. No judgment on your sexual activity, but you need to know what PrEP and PEP is. These are the medications that prevent HIV transmission. We also have peer counseling. We have case management. We have patient's assistance program. That is, once you're one of our patients, we're going to walk through every situation from food to shelter. We're going to make sure here at Hope and Help, you can come in if you don't have access to a computer or internet. You can come here. We have a desk set up for you right out front. We have a computer. We have the internet where you can work and get your applications in. You can file for jobs. We have harm reduction services. Hope and Help is the only one that's certified. The state really works with us for harm reduction. This is a syringe program, and a lot of people might look down on that, but don't forget that last year we took off over 149,000 dirty needles off the street. Dirty needles is one of those ways where you can pass HIV or STI. So it is a very important program that we do. We also have the free condom program. You can just come in and say, yes, I need free condoms. And more importantly, the one I really are our support groups. Very few organizations have our support groups, the type of support groups that we have. These were founded by other staff members. We have something called Restart. Restart is our men living with HIV. That support group meets monthly. It's there for all of us. We also have Beyond Binary. That is for our trans and binary support group. We also have Rise, which are heterosexual women that are living with HIV. We are really proud of our support groups and how they function. They meet monthly. We also bring them all together during the holidays in December and have a really big festival, our highs and lows throughout the year and getting ready for the new year. So we've gone from volunteers in the living room, a group of friends coming together, to a comprehensive health center serving thousands of people across Central Florida.
Thank you very much, Teresa. And that is extraordinary growth. But let's talk about what was the catalyst? What is it that drove this type of expansion over the years?
It was desperation and determination. The epidemic didn't get better, it evolved. In the 90s, we got the antiviral medications that turned HIV from a death sentence into a manageable chronic condition. Now, this was incredible, but it had created new challenges. There are side effects. There's long-term care. Then we realized we weren't just dealing with HIV. We were dealing with poverty. We were dealing with housing, instability, food insecurity, mental health issues, substance abuse disorders, all the social determinants that make it hard for anyone to be healthy, especially those that are marginalized in our communities. We kept evolving. We kept expanding because we kept encountering people's need. I always think of Maslow's theory of hierarchy when you think about what's the basic needs. So before I can even get to my health or my HIV status or even thinking about taking a test, I got to worry about if I have a roof over my head or if I have electricity or if my child is hungry. So today, if you walk through our doors, we're going to figure it out for you. We're going to figure it out with you. We're going to make sure that you're not alone. And if we're not the right partner, guess what? We're going to find the partner. So when you walk through us, you won't walk alone.
Thank you, Teresa. Now, before I sat down for this interview, I did some research on the proliferation of HIV throughout the United States. And what was alarming is that Florida ranks in the top 5 of all states for transmission. And you are located here in Central Florida. How does this fact, this transmission rate, drive the mission of Hope and Help?
It fills us with that urgency, but also frustration, because we have consistently ranked in the top 5 and sometimes in the top 3. We have all the tools to end this. We do. We have preventative medications. We have rapid testing. We have treatment. The science isn't the barrier anymore. The barriers are funding. The barrier is stigma and access. I was giving a speech a couple of weeks ago, and in the room, it was about 90 people, professional executives. And when I was talking about this same situation that we're talking about today, one of the questions was, how are you comfortable talking about this? I stopped and I took a break. And I think I've said this on several episodes because it bothers me. How are you not comfortable talking about it? Florida haven't expanded Medicaid, so there's a huge gap in healthcare coverage. So that's barriers to healthcare. Sexual education. We don't even talk about it. We can't go into our schools. We don't talk about it. We just say abstinence. That won't help us. We need to talk more about it. What Hope and Help does is we're operating in that gap. We're trying to make sure those gaps are filled for all of our clients and each and every one of us that come through there. It's why I think this podcast series is so important, and all the series that we're going to do. We need people to understand. We need you to understand. And if you're listening or if you're watching, I need you to understand the epidemic is still here. It's still hurting people. We're still ranked in the top 3. It's still an epidemic. And here's the thing. It's preventable only if we act.
That is great. So, Teresa, we have spent some time to talk about the services that are provided here at Hope and Help. But one of the things that I want to touch is the personal aspect. the people. Are you able to tell us about anyone, an individual who may have gone through this experience that you can share with us, of course, without violating anybody's confidentiality?
I have to think there was a story of a patient who came here probably around 5 years ago, and they had just been diagnosed with HIV, and they were convinced their life was over. They thought, I'm done, I'm dying. They were only 23 years old, and they felt they had nothing to live for. They didn't know what to do. But guess what? Like I said, when you walk through that door, you are not alone. We assigned that patient a linkage, someone to walk you through each step. One of the things that they found out is they didn't understand what U equal U means. That's the undetectable. What does undetectable mean when it's untransmittable? They had no clue. They just thought they were going to die. So they were already down that path of planning their funeral. Our medical team sat with him. Our linkage and our patient assistants, our partners sat with that patient, explained everything step by step every single day. Within a few months, their viral load was undetectable. And one of the greatest things, and I think if you get to see episode 4, Jonathan would say he loves saying, you're going to live a normal life. You just have to know the education, the medication. You have to know how to take it. HIV doesn't define you. But here's the thing, the medication was only part of what they needed. When you think about, and when people look at you funny, or if your family owns you, you get into that deep depression. So then we're going to start talking about it because it's a ripple effect. You'll lose your job, you'll lose your car, you might lose your home, you could lose your family. So making sure that we case manage or we partner with patients' assistants to make sure that mental health, it's not just the medication, it is mental health. So that's why it's so important to stay with an organization that walks you through every single day so you're not alone. We have peer counselors. And you know how someone can say, oh, I understand what you're going through. Mm-hmm. When we say that, they actually understand because they're living with HIV. When I first came to Hope and Help, and I remember going through my interview, I met a patient and that person said, I'm patient 1 at Hope and Help. That person has been living healthy, normal life with grandchildren for 38 years with HIV because they got the knowledge and someone walked with them. So Hope and Help, we don't just treat HIV, we support you. We support the people.
So Teresa, this story highlights something that is very important. Clearly, you are not just a clinic, but you go above and beyond to take care of the wellness, mental health, the patients that you care for. Am I correct in my assessment?
Oh, absolutely. It's exactly what our early founders understood. They were not just sitting by the beds thinking about the person's T cell count, right? They were thinking, does this person have food? Can they pay their rent? Are they isolated? Are they afraid? Health doesn't happen in a vacuum. We say this all the time. You can have the best medication in the world, but if you're homeless, if you're hungry, if you're drowning in shame and isolation, you're not going to thrive. You have that no motivation. So we built a model that says, and I want to say that, we will meet you wherever you are, and we'll address whatever barriers you're facing. That's what we do. I think that is one of the most important things besides the medication is knowing that we're going to be there for you. So many people have gone to places that say, no, we only do medical care. Go somewhere else for food. Somebody else can help you with housing. That's not what we say. From the moment you walk through our door, your problems are our problems. We're going to walk with you. We'll figure it out together. That's what makes us different.
Fantastic. And Teresa, we spent a good deal of time talking about the founders, those individuals who started in their living rooms, this amazing program. If you were to talk to them today, what would you say to them, given where Hope and Help has come from and where it is today?
I think they will be proud, but they will also be heartbroken. Heartbroken that it's still an epidemic and the stigma is still there. I think they would be proud because we're still growing. We're still evolving. We're making sure we meet the needs. Back in '88, we didn't have social media, right? And today we do have social media. So by any means necessary, we are still growing. So I think they would be like, you got to keep fighting. You got to keep going every single day, offering dignity and hope. I think when they picked the name Hope and Help, it was all about that because they still had that dignity and that pride within them. So I think they would be both proud and probably frustrating and sad that the stigma is still there, that people still believe that it only impacts certain people or that it's a punishment because of someone's lifestyle. A lot of judgment is going on. I think they will be very proud on the progress of where we are with medications like with PrEP and then PEP. So I think they will have mixed emotions, but for the most part, I think they would be very happy to know that our doors are still open and we've weathered it and we will be here for our community.
That is fantastic. And if you go back to 1988 and if you were to speak to them, what would you be able to tell them today based on where you have?
I would tell them, I would look at them and tell them what you're doing matters. It would change the trajectory of our community and so many people's lives that we will touch. Please continue to fight, no matter how discouraging it is, how many laws that come out and how many people look funny at you. What you're doing matters and it will change so many people's life. I would tell them the work that you're starting will last decades. It will continue to last decades. I would tell them the community is still there. The community needs it. I would also say I'm so sorry of the many lives that we did lose, recognizing that we lost lives in the early parts of the HIV epidemic. I think I would also tell them that we're going to keep fighting that battle, keep moving forward with their mission and with their plan to make sure we support our community.
Teresa, why is the fight still so hard, even after these many years?
I think the fight is hard because we're not really fully committed yet. Everyone that's touching from our politics side, the people that are governing our land, I think even with the community, we want to not talk about it. Society norm is to don't talk about it. Let's just hide it. I think healthcare is a whole nother issue for those that can't get access to really good healthcare. I think so many people still deal with the stigma. They're uncomfortable talking about it. So we don't talk, we don't educate, and we really believe that it's going to impact those that really deserve it. We're comfortable with certain levels of preventable death. That's acceptable. And that's not acceptable. It doesn't have to be a death sentence. I think society has become comfortable with a certain amount of poverty. I think that they've accepted a certain amount of homelessness. We accept that. Think about how many times you pass a homeless camp. How many times do we think about how did they become homeless? So I think as a society, we've accepted a certain amount of this and we just go along with it. It didn't impact me, not at all. I had one client tell us, and this is here in Central Florida, we had one of the youngest females test positive for HIV. She was 13. Her mom said, that's not possible. And so we've gotten comfortable thinking that it's only certain people. They're homeless, or maybe they did something to cause themselves to be homeless. No, not at all. We've gotten comfortable with that, and we have to get uncomfortable.
So why keep fighting? That is a question that I see some of the listeners asking is, why keep fighting?
Because if we don't, who will? We've seen what happens when we don't. We already know what happens. We bury too many people. We've buried too many family members. We've watched too many communities devastated by a preventable disease, something that you can live a normal, healthy life with. We've seen how our original founders fought. We've seen how people have taken their own lives. So we have to reclaim that back. We have to keep fighting. Hope isn't a naive optimism. It isn't. Hope is the evidence-based belief that change is possible when we act. Did you hear that? So change is possible when we act. So those that are listening to my voice, I just want to say it one more time. I know I'm holding us up, but I want to say hope is possible when we act. And every single day at Hope and Help, We see that evidence. Every time someone shows up, every single time we walk that with that patient and we walk through their history, they're not just surviving, they're thriving. We're there with you.
So, Teresa, give me one sentence that captures why this 12 series podcast on HIV, Real Talk, Real Solution is important and why it matters.
Okay, I want to say this podcast series matters because silence and stigma have killed more people than HIV ever could. We're done being silent. I'm done being silent. We're going to talk about testing without shame. We're going to talk about prevention tools without shame. And so anyone asks me, how do you feel comfortable talking about this? I feel very comfortable about it because I'm tired of them taking lives. I'm tired of us being quiet and taking lives. So we're done. We're done being quiet.
Thank you, Teresa. Before we close, let's give our listeners a preview of what's coming in the next episode we have coming up in a few weeks.
Sure. I want you to check out episode 2. We actually are interviewing one of our infectious disease doctor, and he was a pediatrician, and he's also on the Hope and Help boards. I think you're going to enjoy that series, and you're going to learn a lot about the medications, how they're used, and how even today, as a faculty member, he is still teaching and making sure everyone understands medication. We're also going to have a series on testing. Understanding testing, what does it work? A lot of times there's myth about testing and we get anxiety. We're afraid of the needle. And how long does it take? And can I get a rapid test? I know right then and there. So check out that one. That's going to probably be around episode 3 or 4. We're also going to be talking about a long series on PrEP and PEP. I mentioned that earlier, but we're going to dig into it with one of our nurse practitioners and how that is being used. There's also the new injectable. So they're going to have an episode on that because there's so many questions. Is it really only once a year or twice a year? And how does that work? And what happens to that medication? And what's the cost? Is there a big difference? A lot of the other episodes are going to be around breaking down that stigma. We're going to come to you on this podcast talking real talk with real solution, no longer being ashamed or having that stigma. We're also going to make sure that as you listen and anyone brings in any questions, we're going to answer them. We're going to have one episode where we've pulled all of the questions throughout our first season and just have a Q&A from our listeners. A couple of times we're going to go live with our TikTok as we're filming the podcast.
But the listener just typed and asked,
why now?
Why now?
Because we can end this epidemic. Together, we can. We have the tools. We have the knowledge. We have the science. What we need is a collective will. It takes all of us. It takes the entire village. And it starts with, you want to say it? I know you're thinking it, education, with the conversation. It starts with us talking with people, understanding what's at stake and what is possible. This podcast is an invitation. And I just want to say this slowly. It is an invitation to learn, answer your questions, your assumptions, to get tested, to support people living with HIV. Maybe you have a friend. Maybe it's someone in your family, but this podcast is just for you to ask those questions to be able to have that solution. This is an invitation to you because as a collective will, we can do this. 37 years ago, that small group of friends that refused to let anyone else die alone, I want you to get that mentality. I want you to get that mindset. They started a revolution in a living room. We're inviting you to continue that revolution. We're inviting you to join me and everyone else at 4122 Metric Drive to start that.
All right. So just talk to us a little bit about how can people, all those listeners that are out there that have heard this discussion, how can they connect with Hope and Help?
You can always drop by. We're at 4122 Metric Drive, Suite 800. We're here Monday through Friday. You can also look at our website. We're at www.hopeandhelp.org. Of course, I've mentioned earlier, we're on TikTok, and that is just hopeandhelp.org. We're on YouTube. You can find this podcast on Spotify and Apple. You can call in and ask questions. You can learn about PrEP. You can learn about testing. You can learn about what rapid testing. We have staff ready to help you navigate whatever you need. We are on Instagram. We're on Facebook and Threads. Talk to your friends about it. Make sure you spread it. As we send it out and you see this link, share it with everyone. Make sure that we share it as much as possible, and we can spread it throughout our community. And next thing, we can spread it throughout the state of Florida. All right?
So, Teresa, any final thoughts as we close this first episode of HIV Real Talk, Real Solutions?
I would say to everyone that is either watching or listening or doing both, if you think HIV doesn't affect you, you're wrong. It affects all of us. Every new transmission is a failure of our collective care for each other. Every person that dies of AIDS-related illness is someone we fail to reach with treatment. Every person afraid to get tested because of the stigma is someone we fail to create a safety net for, or to create safety that they felt safe for. But I would tell you, come see us. Don't be afraid. You won't be alone. We are here for you. This is preventable. We can stop the transmission. We can slow that epidemic down. Thank you for listening. I want you to continue to come back and join all of our podcasts. Join us on TikTok, Facebook, Instagram. Thank you. Make sure you bring a friend. Tell someone about this. Remember, we're changing hope into action, right? And help into healing. Thank you. I'll see you next time.
And thank you very much, Teresa. Again, guys, remember, she is the CEO of Hope and Help here in Central Florida. Stay tuned for the remaining episodes. Again, thank you guys for listening or watching wherever you are.
Thank you.